Hello, good evening everybody, and I welcome you all to our virtual open evening for the Herts and Essex Fertility Centre on what has been our Christmas jumper day. So I do apologise that I'm not wearing my normal uniform, but we've had some nice fun celebrating Christmas, and I wish you all a Merry Christmas and a Happy New Year. So a little bit about what we're going to present to you this evening. Obviously, we're having our welcome. I'll give you a presentation trying to give you a bit of a whistle-stop tour about what our clinic's about, the kind of treatments that we offer, and some kind of idea of what your experience within the clinic might be when you come to see us. There will be opportunities, so we have live questions and answers going on during the presentation, and at the end of the presentation, I will endeavour to show you a clinic video, which is quite technically challenging for me, but I'm sure I will get there. So tonight's team, so I'm Sarah Templeman, I'm the Clinical Nursing Director here at the Herts and Essex. Answering your questions, we have Jackie McAdam, who's one of our senior fertility nurses, and we have Mana coordinating everything, who's our marketing and wellness manager. So a little bit about the Herts and Essex Fertility Centre. We've actually been around for quite a long time. We were founded in 1989 by Mr. Michael Amoy, who still is our current CEO of the clinic. So we have over 30 years of experience within the clinic, and in that time we have helped produce over 8,000 babies. All of our procedures are performed under one roof, which is quite important for you. We're not going to be sending you off anywhere else, so it is a complete purpose-built clinic, which was built for us when we moved to these premises in 2007. We're a fairly small, I think we're classed as a medium-sized clinic, but we actually offer a completely full range of services. So depending on where you are in your journey, whether it's just you're looking for fertility assessment, some screening, we offer a full range of fertility services up to and including surrogacy, and whatever treatment you have, we will follow you through, and we're able to provide treatment for you and care for you up to 10 weeks of pregnancy. So I'll start with talking a little bit about fertility assessment. Quite often we get people who just want to know where they are in their own fertility, and these assessments can be done for a couple coming to us, or as a female or male independently, and they involve different tests that just give you an idea of where you are in your fertility. These kind of appointments are usually for people who are not ready to have their treatment just yet, but just want a little overview of where they are. So I'll talk to you a little bit about what tests we provide for the female partner, but for a male fertility assessment, we provide a semen analysis, including a HbA test, which looks at the maturity of the sperm, which not all clinics will do, and it's a discussion with the embryologist regarding that. But for the female fertility assessments, it includes a 3D ultrasound scan. So we're going to, under ultrasound guidance, put a small amount of saline into the uterus to assess just the uterus, to make sure that there's nothing within the uterus that is going to inhibit implantation, such as a polyp, which is what you see in that nice image there. We also can check fallopian tubes using HyCoSy, which is a very similar procedure, but with this we just use a different contrast of foam. It's important for anyone considering their fertility right from the very beginning to get what we call fit for fertility. It's important to have a healthy body, mind and lifestyle to give you the very best chance, whether you need treatment or whether you're looking at conceiving naturally. We do have a separate website called Fit for Fertility that is linked to us, but you'll find there's some useful information on what to do and how to get yourself into the best place in order to give yourself the best chance of conceiving. And with that in mind, we do have our fertility dietitian. If you wanted something specifically and specific dietary advice, Alex will see individuals and couples, does virtual sessions and some workshops. So we try and provide assistance there by Alex. I'm going to talk to you about the treatment pathway. Whichever way you come to us and whatever kind of treatment you're looking at having, we start with consent forms. We're a heavily regulated industry, which, although it feels quite onerous when we're asking you to complete lots of forms, the HFEA who regulate us keep us very safe, and these forms are very important in determining that everything is handled correctly. So in advance of your appointment, you will be sent login details for a consent platform called Fertility Consent, where you will be asked to complete some questionnaires and consent forms. And this will be sent to you in advance of your appointment, and we will ask that that is completed before your appointment. We will require your passports to be uploaded onto this site so that we've got your identification. And also importantly, you can upload any relevant investigations that you've had previously. So if you've had a journey so far, it's important that we know all of those results so that we can plan your treatment specifically for you. So we're not in the business of repeating tests that you've previously had done unnecessarily. We will take all of those into account. You can see down the bottom, we also have reference to Salve, which is an app. So once you're a patient with us, whatever journey you're having, you can join the Salve app. That allows us to, so it will give you medication reminders if you're on a treatment journey. It will give you reminders about your appointments, and it's a good way, secure way of you communicating with us via a secure portal. If you were coming for a consultation with us, after you've completed the consent forms online, you come into the clinic for an in-person appointment. And that's a nurse-led appointment, and it is an assessment before your consultation. So the nurse will do observations, make sure you're generally healthy, as in blood pressure, pulse, temperature, height, weight, all of that, to make sure you're in a good place for fertility. We also take some blood tests, so we require a blood test for something called AMH. AMH, it stands for anti-Müllerian hormone, and all egg providers we would ask to have that test along with thyroid function. So anti-Müllerian hormone just determines the reserve within your ovaries of eggs, so it gives us a good indication of how you might respond to treatment. As I mentioned, we're going to do height and weight, so that equates to BMI. So in order to have any treatment that's going to require a sedation with us, your BMI would need to be below 34. And that's from a safety point of view, because we're a standalone clinic and we don't have the backup of a big hospital next to us. So it's to make sure everybody's safe within that. And as part of the pre-assessment, if you have a male partner, the male partner would be asked to produce a semen assessment. And then you'd have the consultation, and this is usually an online appointment, although it can be an in-person appointment if you prefer. Usually online, the invitation is sent on the day of the appointment. It's an hour's appointment where you have that fertility specialist to yourself. Obviously, they're going to go through the results of the tests that have been performed at pre-assessment. They're going to talk through any results that you've had previously, and they're going to talk to you about a treatment plan, whether that involves treatment or whether it involves, you know, optimizing your general health and trying naturally for a bit longer. If you are having any treatment, we have to, our regulation dictates that we have to screen your blood for HIV, hepatitis B, 2 different types, hepatitis C, chlamydia and gonorrhea. And as I discussed, all egg providers, we will need to take blood for AMH, and we also perform tests for rubella and a full blood count. These results, if this is your first egg collection within the UK and first procurement of gametes, must be within 3 months of starting treatment, and either can be carried out with us, and if they're not carried out with us, they need to be carried out at a UCAS accredited lab, and we need to have results in that format. I'm going to talk to you about IUI. So quite often a starting point for people when they're looking at treatment is intrauterine insemination. And this is a procedure where the healthiest available sperm is introduced directly into the womb. It's used to aid pregnancy specifically in heterosexual couples where there's potentially psychosexual problems, a reason that intercourse would not allow them to have the pregnancy, or people using their own eggs and uterus with donor sperm. That's our sort of main criteria. So for our same-sex female couples, it's often a very good starting point for them. So I'm going to talk to you now about the IVF treatment pathway. I appreciate that not everyone is looking at having a full IVF cycle, but as just a little sort of introduction to what we do in the clinic, it will give you a good idea of how things work. So if you were having a cycle of IVF, we would have talked to you about a plan in which we ask you to call us when you get your period. When you get that period, we need to then book an ultrasound scan for you between days 1 and 3 of that cycle. Whenever you have your scan on day 3, you would start your first drug, sometimes day 2 or day 3. And the first drug is a follicle stimulating hormone. So it's an additional amount of the hormone that your body produces naturally each month to make one egg grow, and we give it in higher doses to encourage multiple follicles to grow, so that we hope to collect multiple eggs when we get to egg collection. This drug you would usually take for 10 to 12 days. It continues throughout treatment until 2 days before the egg collection. It can have side effects, perhaps exaggerated symptoms of your normal menstrual cycle, headaches, mood swings, breast tenderness, and definitely bloating as you approach egg collection. But generally, most people don't suffer too badly on this protocol. So you have that period of daily injections. We have a scan 1 there, which is actually scan 2 because you've had one just before day 3. On scan 1, we're going to be looking to see if the follicles have started to respond. So this is an image of an ovary sort of halfway through stimulation. It looks like a bit of a cobweb, but the black sections that you see there are what we call the follicles. So what we're looking at are fluid-filled sacs that hopefully when they reach a specific size will contain a mature egg that we can collect. So we are going to be measuring each of these follicles in cross-section, and it is when they get to a specific size that you'd then be placed for egg collection. But at this second scan, we will usually be introducing another drug called Cetrotide. Cetrotide stops your body ovulating too early, so it allows us to control ovulation for when we have the optimum time for your egg collection, whilst we continue to monitor you. When you come for your scans in the clinic, so you have your scan with a sonographer. The sonographer can be either a doctor or a nurse. We have qualified sonographers across those 2 categories. But after you've been seen by the sonographer and the next steps have been determined, you go to see the nurse who goes through everything with you, goes through all of your medication, make sure you know what you're doing, so you will always have everything properly explained. On the 3rd scan is when we would usually determine that you're ready for egg collection once the follicles have reached the optimum size. The image that you see is an image of what your lining, so your endometrium, which is the lining within your uterus, will look like on scan as you start to stimulate. So you can see that we've got 3 clear lines there, and that's what we're going to be looking for to determine that that's a nice environment for an embryo to implant within. So as I said, that final scan will determine the date and time of egg collection. Some people need a further scan, some people take a little bit longer. It doesn't matter, and it doesn't have any effect on the outcome of the treatment, how long your stimulation is. A bit like women's cycles are all different lengths, so will that stimulation period be different lengths. So sometimes you might need a further scan. But at the final scan, whenever it is, we will give you details of your egg collection. We give you very detailed written information at that point. We will give you a specific time of your trigger injection. Now, this is very important. A trigger injection will be 36 hours before your egg collection. So, for example, if we're going to book you for an egg collection at 9 o'clock on Monday morning, we're going to tell you to take your trigger injection at 9 o'clock on Saturday night. And that is the one medication that needs to be very specific time-wise. And as I said, we give you very detailed verbal and written instructions at this point in time. And you're then going to attend the clinic for an egg collection. This is a procedure that's done under sedation. It's a sedation that's administered by a consultant anaesthetist, and it's a sedation where we expect you to be asleep. So you'll be admitted to the recovery bay, and we'll do your baseline observations, that blood pressure, temperature, such things. If there's a sperm provider, the sample needs to be provided and prepared. The sedation will be given. You'll be here in total for probably about 2 hours, 2 to 3 hours on the day of egg collection, depending on how many eggs you have, so how long the procedure takes and how quickly you wake up. But you will be discharged once you've recovered, once you've had something to eat and drink. And it's important to know that you always will need someone to accompany you home after your egg collection. So I'm going to talk to you now about what happens behind the scenes in our laboratory, the exciting bit, I guess. So we talk about embryos and treatment from day 0 to day 6. So day 0 is egg collection. So on the day of egg collection, we will collect your eggs, the extra parts. So if you're coming to us for egg freezing and fertility preservation, that will be done on the day of egg collection. It's becoming increasingly popular for women to preserve their fertility, and that's become increasingly popular as the techniques for freezing eggs have become better. So for many years, egg freezing wasn't very successful, but now with a process called vitrification, it gives people a real chance to just preserve their fertility for the future. And this could be for social reasons. It could be due to menopause, cancer, surgery, and we do offer counselling for anyone considering egg freezing. And we do also have a sister website called My Eggs My Future with lots of information about freezing your eggs and preserving your fertility. But if we're not freezing those eggs and we're going to be inseminating them with sperm, there are 3 different ways that we can mix the eggs and sperm together. So IVF is when there are normal sperm parameters. So that's when a normal semen analysis has taken place, and there's no reason to think that that sperm would need any help to fertilise that egg. Probably the image that most of you will have seen of what we call IVF is actually an image of ICSI, which is the image that you see on the right hand side there. And ICSI is used when there are low sperm parameters. So that can be anything. It's not necessarily just the count. So if you have a reduced count, or if it's not as motile as it should be, so it's not swimming as well, or if there's an increased amount of abnormal sperm, just to introduce that sperm into the egg helps increase the chances. Some men have no sperm in their ejaculate, So we need to remove the sperm surgically, and when we do that, the sperm tends to be of poorer quality, so needs just that little bit of help with the ICSI procedure to fertilise the egg. Some men produce anti-sperm antibodies, so that means we have plenty of sperm. They swim nicely, but they tend to clump together, which makes fertilisation difficult. And anyone who's got a history of a previous failure to fertilise or low fertilisation, we would recommend ICSI. So this is a little video of an ICSI procedure. So the needle that you can see there is the width of a human hair, just to give you scale. You saw a little sperm swim by, and you will see the embryologist focusing, and they will select their sperm. Here it comes shortly. So the first thing they need to do is stop that sperm from swimming around so it doesn't swim straight out. So first of all, it looks a bit brutal, but you'll see that they're slashing the tail of the sperm, and that's to immobilise it. All the good bits of the sperm are contained within that head, so that's just to stop it swimming. They've sucked it up into their pipette, and now you'll see the egg. So you can see the difference in scale of the egg and that pipette of a human hair. So the egg is actually the largest cell in the human body. And you can see there's our little sperm at the end of the pipette. So that's just going to be gently introduced. So there's a membrane around, it just pops, and they just suck a little bit of the fluid back up into the pipette to mix the sperm with it, or they gently just deposit the sperm in the centre of that egg. And then that goes into the incubator overnight, and we see what's happened. It doesn't guarantee fertilisation, this procedure. It just gives a little help. The egg still has to accept that sperm and start to fertilise. So we also have a method called PICSI, which is the same procedure as ICSI in terms of introducing eggs and sperm, but it specifically identifies mature sperm. So for those men who have lots of immature sperm within their sample, we would then use PICSI to help. Okay, so the next day, on day 1, we are going to have a look in our incubator. So regardless of which method we've used to introduce eggs and sperm together, from now on it's the same. So we would like to see a normally fertilised egg. So when you get your phone call from the embryologist, they will be telling you how many have fertilised normally. That image on the left is of a normally fertilised egg, and if you look, you can see 2 little dimples in the middle of that egg, and that indicates male and female DNA within that egg. We do get eggs that fertilise in an abnormal way, and the one on the right indicates that there's too much genetic material within that egg, and it wouldn't go on to form a normal baby. So they're discounted at that point in time. So we tend nowadays, if you have a good number of fertilised eggs, we will usually tell you that we're going to leave them in the incubator undisturbed until day 5. But what they are doing between day 1 and day 5, just some pictures there. For women who have very few, so if you only have 1 or 2 embryos, we do potentially transfer on day 2 or day 3, but for most patients we'll transfer on day 5. But at day 2 you'd expect to see a 4-cell embryo, which is our image on the left. And by day 3 we'd have expected to divide between 6 and 8 cells, and they're both images of nice embryos. So mostly we leave them. Day 4 we never look at them, because as you can see that there's nothing clear. Everything looks a little bit messy and complicated on day 4, and it doesn't give us any information. And this is because the embryo is undergoing a process whereby it starts to try and form a blastocyst. And what we see at day 5 is a blastocyst. So that's an image on the right of our blastocyst. You can see within that blastocyst there are 2 distinct areas. The ball at the top left is what we call the inner cell mass, and around the outside those cells are what we call the trophectoderm, and they're going to create the placenta. So the inner cell mass will go on to produce your baby, and the trophectoderm will create the placenta. And this, you'd expect these embryos to have about 120 cells, so it's gone under a big divide from day 3, where we were looking at 6 to 8 cells, to this beautiful blastocyst. Not every embryo is capable of making it to a blastocyst. In order to become a blastocyst, an embryo has to start to make its own DNA rather than rely on parental DNA. So it's a big stage. So this is why we prefer to transfer at this stage, once we have that information to know it gives you a good chance of success. When you come for your embryo transfer, you will be given an opportunity to see your embryos on the camera, and you will be given a picture to take away with you. We do offer something called embryo glue to all patients. It's not literally glue, but it is a transfer medium which mimics the conditions in the uterus. So we prepare the embryos in that just for conditions, and to aid implantation after transfer. On day 5, you may have opted to have your embryos genetically screened by a process called PGT. We offer this service, and at day 5, they would take a small biopsy of the cells from around the trophectoderm and send them off to see whether your embryo has the genetic integrity that is normal and will allow you to have a good pregnancy. They can also test for specific conditions that can be inherited. In this instance, if you do have PGT, your embryos will all be frozen and transferred on a separate cycle once we know which are the good ones. So we also can freeze embryos on day 5. So if you've had a PGT biopsy, we'll then freeze them. But any embryos for anybody having a non-frozen cycle, but that are remaining and are of good quality, we can freeze for you on that day, or indeed the next day at day 6. So this is our treatment pathway up to embryo transfer. After embryo transfer, we provide medication in terms of extra progesterone, referred to as luteal support. So that phase after embryo transfer is your luteal phase, and you will be asked to perform a pregnancy test 16 days after you've had your egg collection. And as I said earlier, our care will go up to, so your treatment will include a 7-week scan. So the left-hand picture is what a 7-week pregnancy should look like. And you can choose to have a 10-week scan with us, and we do offer the NIP test, which is genetic screening for the 3 main trisomies, which is Downs, Edward and Patau, and will also allow you to know the sex of your baby at 10 weeks old. So some of the other treatment options that we offer within the clinic. So we offer egg and sperm donation, needed for a variety of reasons. As you can see there, we have our own in-house sperm bank, and we also work with external sperm banks, and the same for eggs. We do offer those treatments, and as I said earlier, we also we've probably done as much surrogacy as any other clinic in the country. We have been actively running a surrogacy program since 2012, and I suspect we've done 400 cycles now. So that was as of April this year. We do have a dedicated surrogacy team for intended parents and surrogates. They're complicated cycles. Many cycles also include the use of egg donors, and they are for heterosexual male same-sex couples, single people using their own gametes, and they take the format of either full host surrogacy, where we're using where the surrogate does not use her own eggs for the pregnancy, or straight surrogacy, where the surrogate would use her own eggs for the pregnancy. We also have 3 ICBs that we're able to see NHS funded patients for, Mid and South Essex, North Central London and North East London. Your ICB is determined by the location of your GP and not your home address. So you'd need to visit the NHS website for funded treatment just to see if you would be eligible to come to us. So this is the areas that are funded by the North East London ICB. So Barking, Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets and Newham. Or we have Mid and South Essex, Mid Essex, Castle Point and Rochford, Basildon and Brentwood, Thurrock and Southend. And then we have North Central London, which covers Barnet, Camden, Enfield, Haringey and Islington. So they're the areas that we cover. But if you're not eligible for NHS funding or you're not able to come, we do have some other options for you. So we run both egg and sperm share programs, whereby if you donate your eggs or sperm to us, your own treatment will be funded. So there's extra information available for that. If anybody specifically wants it, pop it in the chat and we can send that through for you. While we're talking about money, if you did want to book a consultation appointment as a result of attending this evening, you do get a 50% discount on the cost of the consultation. So a full price consultation is £250. And if you book by Friday the 9th of January, you would get that for £125. We also have some work with some companies who will give you funding options. They give you various packages of treatment, so number of treatment cycles, and they will give you, if you're not successful, quite often you'll be able to get some money back, and they do both offer 0% finance. So there are a few ways of funding treatment if you're not lucky enough to be funded by the NHS. Emotional support is very important to us here at the Herts and Essex. We I think pride ourselves on hopefully I think we do this really well. We are here to support you. We provide counselling if you need it, but equally all the staff here, from the person you speak to on the phone through to all of the people you see for your treatment, are here to support you at every stage. So why us? So we've been around a while. Many of us have worked here for many years, myself included. Importantly enough, and I probably didn't say this earlier, we run a 7-day-a-week laboratory service. Very important, because it allows your embryos and what's happening with those embryos to determine when you have your treatment. So basically, if your embryos need transferring at the weekend, that's when we're going to transfer them. So a 7-day-a-week service is very important. Everything that happens within our laboratory is electronically witnessed. So as well as being witnessed by 2 humans, it's also what we call, it's almost bar tagged, so that you couldn't put the wrong, Mr. Jones's sperm and Mrs. Smith's eggs in the same hood without it alarming. So you are safe with us. We've made a lot of babies. I think support throughout your treatment is something that we would aim to really do for you, and emotionally and physically. Free parking, we do have a car park, which I guess is a good thing. So we do value your feedback. I think you will get a link for feedback. So yeah, please, good, bad or indifferent. It's important to us to know what you think and how we can improve. Social media, please do follow us. We have active social media on Facebook, X, Instagram, LinkedIn. We're on TikTok, and we do have a YouTube program channel too. So to book an appointment, so obviously you can call us. We have an inquiries line, inquiries@heartsandessexfertility.com. We will usually, depending on the time of year, we get busy times of year and not. So I probably can't promise within 2 to 3 weeks at the moment because it's a particularly busy time of year. But normally we would have a new consultation appointment available within 2 to 3 weeks. The reason it's busy and everything at the moment is because we do close for a week in between Christmas and the New Year. So we will be closing on Christmas Eve and closed Christmas Day through to when we reopen on the 5th of January. So I hope you've all been asking any questions that you have. Thank you for your time, and I am now going to endeavour to share our clinic video with you. So just bear with me a moment while I do that. What's happening, Alana? I've got it. Opening things. So stop sharing. Okay, so thank you very much, everybody, for your time. We will stay online for a bit to answer any questions that you still have. And may I wish you a Merry Christmas and Happy New Year. Thank you.